My name is Justin Love. I'm a dermatology PA. I've been practicing for 18 years. Ooh, biggest takeaway, to keep an open mind. Um, my session has a lot of, nice medicine pearls, different, treatment options, different treatment techniques. But there's also a lot of life experience, some emotional aspects, patient interactions, difficult to talk about situations with patients. And so I hope they come away with a few pearls on how to have good patient provider interactions and discussions. I know this sounds very hard to do in a very busy clinic, but when it comes to very difficult patients or difficult diagnosis, my pearl would be to always be available. We don't always see things that are super complex, but when we do, or when we come up with really challenging diagnosis or difficult discussions, we have to try to make space for that process and bring a patient back in, have a very lengthy discussion. And that's kind of what medicine calls for sometimes. Not everything is easy, but that's what we signed up for, and we're aware of the challenges. And so just making sure that we create enough space for our patients to come in so we can have those difficult conversations. So in one case that I present, a younger woman, ends up showing up with these little itchy bumps on her arms. We ended up biopsying it, and it showed up to be similar features that you would see within the uterus. And so when you have the same growth of a process that's happening internally, and you see that showing up in the skin, that kind of warrants a little bit of a deeper dive, a deeper investigation as to why that process is happening as well. Sometimes with itch as well, people come in super itchy. They don't know why they're itchy, and you run a few labs and realize that they may have some, bile duct issues, liver issues, kidney problems. Itch itself is a huge diagnosis in which we kind of have to rule out all of these other processes that can happen. Develop your interpersonal communications. Have that aspect of intelligence. Outside of the medicine, outside of the science. Be able to develop interpersonal skills, that intelligence aspect of it, being able to communicate effectively, being open to what others have to say as well. Is going to be really important. That emotional intelligence aspect of your profession, I think, kind of gets missed or kind of overlooked because they're all in school, they want to pass boards, they want to get their dream job and their dream location, and I think that emotional intelligence aspect sometimes doesn't get as much attention, but I think that is a huge aspect of working in as an APP. The biggest challenge I think PAs and NPs face today, I think, is still trying to find their place and their footing maybe in the dermatology setting. I think there may be a little bit of an older adage where it's like we have to do this one thing and then our collaborating physicians do this other thing. And I think we quickly realize that we can both kind of do similar aspects of patient care. And I think we collaborate for a reason. That's why I like to refer to, collaborating physicians, because we often kind of share different aspects of responsibilities. Because to me, it's all about just patients getting access to care. You can't just be the only person that can only treat this one condition. We have to be able to get patients access, and I understand that there are certain cases that are really tough and hard, but that's important to have that bridge to kind of help out in certain cases, because only one person can only do so much. It takes a team-based approach, and I very much approach medicine as like a team sport. You have your LeBron James of the league, and you have your Michael Jordans, and thankfully, hopefully we have access to superstars. So one trend that I'm interested in is the aspect of disease modification. With so many different inflammatory disease states, do we have the ability to incorporate medicines earlier on in the inflammatory process to kind of modify that as patients get older and as they kind of deal with it? I think that's what I'm probably most excited to see, is to see how early intervention with our advanced, biologics and small molecules, and does that kind of impact a patient's longevity as they get older, as they deal with some of the chronicity of some of these diseases.